Hello students, today we are coming with the next topic, that is adverse drug reactions. In the previous class we have discussed about the dose response curve, that is the DRC, and the therapeutic index. There we have plotted a graph with respect of dose and response, and we have found out the therapeutic window or the safe zone or the safety or the potency of a drug, so that we can understand that which drug at which dose is showing its maximum or effective response. Now, today we are coming with the topic, that is adverse drug reaction. In the adverse drug reaction, we are going to see that how a drug shows its adverse effect on which amount of dose administered and how administered. First, I will say that adverse effect is any undesirable or unintended consequence of drug administration. Which means what? It doesn't have any proper desirable or intention of any drug administration. That means it is not specific for its administration. So, as it is undesirable and unintended, so it causes a broad term that includes the three main things, that is noxious effect, trivial, serious, or even fatal effect. So here is the contents of the slide. For the contents, it has included the definition and the classification has been made on the basis of three key points. First, the onset of event. Second, the type of reaction, and third, the severity of reaction. So previously I said you all that what is an adverse effect. Now I would like to discuss that what is an adverse drug event. Adverse drug event can be said as any untoward medical occurrence that may be present during the treatment with a medicine, but which does not necessarily have a causal relationship with the treatment. So this we are going to look forward in our next slides, and what next is the key points of the ADR. The terms that we are going to come across while studying this part are adverse, AE, which means the adverse event, ADE is the adverse drug event, and ADR is the adverse drug reaction. And for your examination, if you write the short forms then or the annotations, then you have to write its full form, because AE, ADE and ADR are not the standard short forms. So now coming to the main topic, that is definition of ADR. As first I said that it is undesirable and unintended. These two words are very important and you have to focus it while writing your definition. Undesirable, unintended consequence of drug administration. So as a result of it, what are the effects we can see? That is noxious effect, trivial, serious effect, or even the fatal effect. Now, what is an adverse drug reaction? This was the adverse effect. Now, the ADR, it is defined as any noxious change which is suspected to be due to a drug occurs at doses normally used in man, requires a treatment or decrease in dose, or indicates a caution in the future use of the same drug. This means what? If we brief it all, it is the amount of drug administered. With respect to that, we are going to see its reaction. But if the dose is in its excess or if it is less, it is showing a noxious effect, and that noxious effect can be termed as adverse drug reaction, because that noxious effect is unintended and undesirable. Below you can see on the right hand side there is a diagram which is showing the adverse drug event and adverse drug reaction. So here you can see that this is a causal relationship which is being established or which can be suspected, and in adverse drug event there is no need to have a causal relationship. Means what? The adverse drug reaction, when it is happening, it is occurring involuntarily, but the event is not involuntary because it is not a causal. We are known to the fact that that event may occur due to the previous subsequent events. Now coming to the next slide, that is the classification of the adverse drug reaction. The adverse drug reaction is basically classified on the three basic points, that is onset of event, type of reaction and severity of reaction. Now if in the examination you are being asked that write the classification of ADR, you are supposed to write the type of reaction mainly, and if you remember this onset and severity, it is good, but mandatorily you have to write the based on the type of reaction of ADR. That is the most important, or they are expecting that answer only. Now the first classification, that is based on the onset of event. With this onset word you can understand that there will be a time specific that is provided. See, as this is a slide, I have made it very short and precise, but here the acute, the subacute and the latent, here the time periods are also being provided. So with this you can see how much time consumption is taken for each of the events, but when you are writing for your exam, you have to write it in a whole sentence. Here I have just briefed it in a very smaller scale so that you can understand, or you can just get the heads up point. So for acute we have seen that it has taken less than 60 minutes, subacute is 1 to 24 hours and latent is greater than 2 days. So the occurrence of such event is very much time specific, and with this exact times you have to write your answer. If you don't be able to change this timing, there is 60 minutes or 1 to 24 hour or greater than 2 days. These are the fixed amounts. Next, coming to the main and the important, that is the type of reaction. First you can see that it is type A, augmented, type B, bizarre, type C, chemical, type D, delayed, type E, exit, type F, familial, type G, genotoxicity, type H, hypersensitivity, and type U is unclassified. Now a key thing to understand here is, you can see that according to the alphabets, the starting letter of the word is matching with that. So with that you can remember, like A, augmented, B, bizarre, C, chemical, in this way. So these are the tricks how you can remember the A, B, C, D, E, F, G, H, and last is the U. That may be an odd one out, but only that is U. But here, based on the type of reactions, the adverse drug reaction is mainly based on the first 5. That means from A to E. So we are going to explain from A to E in the next slide, but when you are writing the reactions, you have to write from A to U, all of them. So here type A is a augmented reactions. So in this, augmented means they are expected undesirable reactions. Means what? The reactions that are going to occur are known to the pharmacology of the drug. This is the first point. Second is dose dependent. Next is it can be alleviated by a dose reduction, means as it is dose dependent. So if we increase or decrease the dose, it is dependent on that. And most importantly, you have to cite examples with the type of reaction. Like for this here, it has been cited with the anticoagulant like warfarin, bleeding, beta blockers, bradycardia, beta blockers, you can say propanolol, metoprolol, atenolol, nitrates like you can say vasodilators that causes the headache, and prazosin that is causing the postural hypotension. So for all these types, if you cite one example of drug, then that will be even better. Next is the type B, that is bizarre reaction. So here what is being said that the drug is not dose dependent and it cannot be predicted before. Means previously what we have seen in Augmented, the prediction can be done before according to the pharmacology of the drug administered, but here as it is dose independent, so here we cannot predict what is the effect of drug, and what is extra for this, it is a host dependent factor and it is important in predisposition. So for example, we can see we have cited penicillin for the anaphylaxis, means the allergic reactions, anticonvulsant like any of the barbiturates, diazepam, lorazepam, those are used for the hypersensitivity reaction. Next is type C and type D. Type C is the biological characteristics can be predicted from the chemical structure. So here a chemical structure determines the biological toxicity or the biological characteristics, whether the drug is toxic or it is having a good therapeutic effect. For example, here they have shown an example, that is paracetamol causes hepatotoxicity. Next is the type D, that is delayed reaction. In this delayed reaction, what we are seeing that over years and years, means after a prolonged treatment due to accumulation of the drug, this type of reactions are occurring. So the most prominent example is the chemotherapy. Any chemotherapeutic drug, as it has been used for years, you can see permanent adverse effect like hair loss, then yellowish coloration of teeth, such problems you can see. Even a very prominent example is phenytoin during pregnancy. It is causing a phocomelia or the teratogenic effects, means malformation or deformation in the neonatals. And the antipsychotic drugs, that is causing the Tarkiv, dyskinesia, and then the analgesics, which is causing the neuropathy. So these effects that are being seen over a prolonged adverse effect of the drug administered. And the last type is the type E, that is the end of the treatment reaction, or you can say the exit of the treatment. So here for this we can see that withdrawal of the drug is being stopped abruptly, means suddenly stopping the use of drug. So what happens, like for example I have cited here seizure or epilepsy. What happens? Phenytoin is a very common type of anti-epileptic drug. Suppose the patient should be given for 2 weeks, and if it is being taken after the first week, then again the relapse of the seizure or epilepsy can be seen. Similarly, for a steroid withdrawal, what is causing? It's causing adrenocortical insufficiency, means the adrenocorticoid is not sufficiently secreting the hormones. Now coming to the third point of the classification of ADR, which is based on the severity of reaction. It is basically the 4 types. First is minor ADR. In this minor ADR, there is no medical therapy, no type of antidotes provided, no hospitalization, or even the prolongation of hospitalization is not required. Next is moderate adverse drug reactions. In this, what we need is there is a need or change of drug therapy, specific treatment to be provided, or even it may cause a prolongation stay in hospital by at least 1 day. Next is severe adverse drug reaction. Here it is potentially life-threatening and has a permanent damage, which means what? It has a permanent impact for its adverse drug reaction, and it also requires a intensive medical treatment. And lastly, that is lethal, that is directly or indirectly contributes to the death of the patient. So here, no prolongation of hospitalization, no medical therapy, or no providence of antidote is given. It is so much toxic and without, means reaching a level which is without or beyond treatment. So directly it is contributing to death. So this was the entire topics that we covered in this slide. Hope you all liked it and this will help you in writing the assignments, and please give up the assignment for your next class and write the answers carefully.